Good morning. I think it's almost good afternoon now, and I'm sure it's a exercise in patience that we talk about every day, waiting for this, for us to get here. So as we turn the calendar over to March, we are reminded that it has been almost 12 months since the pandemic began for us in earnest here in P.E.I. When it started, we realized it was new territory for everyone, and there was no playbook to guide decisions. Since the pandemic began, we have learned much about the devastating impacts of this global pandemic on some populations, especially those in long-term care and communal living environments. We have also learned a great deal about COVID-19, and most importantly, how to manage this virus. 1 year ago, we could not have predicted where we would be in March 2021. And few, even the most optimistic, could have predicted there would be a safe and effective vaccines against COVID-19 and that our vaccine distribution plan would be well underway. Today, I will give you an update about COVID-19 and discuss our vaccine distribution plan. In P.E.I., there are 4 new cases of COVID-19 to report today. One is a male in his 20s that is a close contact of a positive case related to a cluster of cases in Charlottetown. Interestingly, this individual initially tested negative and developed symptoms and was positive on a subsequent test. As a close contact, this young man had been in self-isolation since his initial test. One is a male in his 20s, and the investigation and contact tracing is just beginning, but likely related to travel. The other cases are a male and female in their 20s who are connected to each other. Public health nursing is investigating if these cases are related to both the clusters of cases, the cluster of cases in Summerside and in Charlottetown. These cases are now in self-isolation with mild symptoms. Since the pandemic began, we've had 136 cases of COVID-19 and currently have 22 active cases. During the past week, we have been dealing with an outbreak of COVID-19, and this is really to summarize. A cluster of about 11 cases in the Summerside area, all in their 20s. A cluster of 6 cases in the Charlottetown area in individuals, mostly in their 20s, and 1 in her 50s. And we have 1 male in his 20s with a history of travel outside of Atlantic Canada. And as I mentioned, a male in his 20s, and the contact tracing and investigation is just beginning, but appears to be travel related. We've also had 2 females in the Charlottetown area test positive after traveling from P.E.I. to other part of Atlantic Canada. These cases were announced last Wednesday, February 24th. Late yesterday, our office was advised by the provincial lab and the National Microbiology Lab that these 2 cases were related to the variant B.1.1.7 first identified in the United Kingdom. Although not unexpected, the presence of a variant of concern is a reminder that we are susceptible to variant strains of COVID-19. Variants of concern are known to be more infectious, meaning they can lead to exponential spread. All of our positive samples are routinely sent to the National Microbiology Lab for genetic sequencing, and typically results are available within 7 to 8 days. We should know the sequencing results of some of our other cases, hopefully by the weekend. In the meantime, out of an abundance of caution, we will continue to manage all cases as if they are variant strains. As Premier King recently noted, no one intends to contract COVID-19 or bring it into the province. Now more than ever, it is the time for Islanders to be supportive and understanding towards people with COVID-19 and their 205 close contacts. In all cases, these individuals got COVID-19 while going about their daily lives. This is a reminder to every Islander that the virus moves when we move, and that we should think twice about the type and length of our interactions with people outside our households, including the need to travel off island. Effective Sunday at midnight, P.E.I. moved into the alert level red measures with modifications for at least 72 hours. These restrictions will allow us time to do additional targeted testing of asymptomatic islanders and gain a better understanding of the extent of the outbreak. In particular, it was strongly recommended that young people aged 12 to 29 or 14 to 29 in the Summerside area without symptoms of COVID-19 be tested. In addition, young people aged 19 to 29 who worked in certain areas such as food service sector, delivery and transportation, fish and meat processing, call centers, and those who are not vaccinated and work in long-term care. As I mentioned on the weekend, testing of people both with symptoms and without symptoms is key to helping us control this outbreak and break the chain of transmission of COVID-19. During the 3-day period between Saturday and the end of the day yesterday, over 10,000 tests were collected across P.E.I., including 2,800 rapid tests taken at the clinic in Stratford and Three Oaks. As of this morning, there are just over 2,000 tests pending. Thank you to all the young people across the province who responded positively to the recommendation to be tested. As evidenced by your actions, it is obvious that you listened and heard the advice. Your willingness to help us get the current outbreak under control is encouraging and is an excellent example to everyone in our province. Thank you to each and every one of you for your leadership and for caring about your health and the health of your friends and the community. A heartfelt thanks to the hundreds of people who worked tirelessly over the weekend to meet the demand for testing. Thank you to our partners at Health P.E.I., at the testing clinics and the provincial lab, Island EMS, Department of Transportation and Security. I also want to thank the many other public health staff who worked long hours over the weekend to do contact tracing and other necessary yet behind the scenes work to manage this evolving and serious outbreak of COVID-19. And a special thank you to the Chief Public Health Office staff and my team. Our slow and steady march to immunize islanders continues. Despite the spike in cases and associated increase in testing and contact tracing, the vaccine distribution plan continues uninterrupted. As of Saturday, February 27th, a total of 12,596 doses of vaccine have been administered. And that means 7,377 individuals have had at least one dose of the vaccine. Our goal is to immunize 80% of all adults in P.E.I. The AstraZeneca vaccine has been approved by Health Canada, and although we don't know the exact number of doses, we do anticipate doses to arrive and possibly very quickly within the next couple of weeks. We are in discussions regarding the optimal target population for the AstraZeneca vaccine, and I will share more information about the AstraZeneca vaccine next week. Based on emerging evidence and population-level data, the National Advisory Committee on Immunization is anticipated to release guidance on extending the second dose of the mRNA vaccines. This guidance is based on research and data about how well the vaccine works after the first dose. 2 weeks after the first dose, individuals will have very good protection. But of course, in order to have that protection maintained, a second dose or booster injection is needed. This anticipated guidance is a significant development and a game changer for P.E.I. Given we expect to receive approximately 100,000 doses of vaccine in P.E.I. between the 1st of April and end of June, and based on this anticipated guidance, we plan to offer every islander over the age of 16 a single dose of vaccine by the end of June. All individuals over the age of 80 will receive the 2 doses based on their existing appointments. However, going forward, others will receive a longer time interval in between their first and second doses. This approach will allow us to achieve herd immunity more quickly thereby protecting more islanders from COVID-19. While some of our vaccine shipments were disrupted in February, now we are expecting enough vaccine to forecast the rest of the vaccine rollout. If all adults are vaccinated with 1 dose by July 1st, we will have a better summer than last year. And it may not be the summer like we would have had pre-COVID, but because we can expect that some public health measures will remain in place, and there may continue to be some border measures in place. But this is overall very good news. In April, we will let you know more about what achieving herd immunity in the adult population may mean for travel and activity this summer. But knowing that it may be possible to have all adults over 16 partially vaccinated in the next 4 months brings the finish line into much sharper focus. And I know people are wondering, where am I on this list? As you know, we have immunized and offered immunization to those in long-term care and community care, and the staff working in long-term care and community care. A number of healthcare workers who have been involved in the COVID response and our frontline healthcare workers have been vaccinated or are being vaccinated. The vaccine clinics have started in our First Nations communities. We are currently immunizing rotational workers and healthcare workers involved in direct patient care and individuals in congregate living environments. Between April and June, we will focus on those in phase 1 who are not completed, first responders, including police, firefighters, and utility workers. In age categories, beginning with adults over the age of 75, moving down in 5-year increments, those over the age of 70, and then over the age of 65, and those over 60, as well as other frontline essential workers, age 18 to 54, who cannot work virtually. And these will include teachers, public transit drivers, seafood and meat plant employees, grocery and retail clerks, as examples. Indigenous adults not immunized in the first phase. Adults age 18 to 59 with underlying medical conditions who are at high risk for severe outcomes and their primary caregivers. Examples of underlying medical conditions include Down syndrome, cystic fibrosis, COPD, organ transplant recipients, people undergoing chemotherapy, to name a few. Adults between the ages of 50 and 59, beginning with those over 55 and moving down in 5-year increments to age 20. Non-frontline healthcare workers needed to maintain system capacity, and non-frontline essential workers, and all remaining adults over the age of 18, followed by youth aged 16 to 17. Beginning in July, second doses will start to be administered. Youth age 15 and under will be immunized as vaccines are approved for their age groups. And non-permanent residents, international workers, and students will also be immunized. There will be public announcements when it is time for each group to book appointments, and I know Marion will be involved in that going forward. Systems and processes are being tested through Health P.E.I. for booking appointments to prepare to ramp up later this month and in April. We ask for your patience and understanding as we continue to distribute vaccine to all islanders who want to be immunized. As I've said before, there will be vaccine for everyone. My final point on vaccine is the primary goal of the vaccine program is to protect people from severe disease and hospitalization related to COVID-19. Also, any vaccine that is approved by Health Canada is safe and efficacious. Islanders can be assured that if they are offered a vaccine, it is appropriate, safe, and effective. We've had a couple of questions about enforcement just before I finish. Justice and Public Safety is leading the enforcement activities related to COVID-19, and they have been an excellent partner since the pandemic began. To date, they've received 587 complaints or tips. They have visited 709 residences and completed 6 business inspections. 200 warnings have been issued and 111 charges laid, including a $5,000 corporate fine this week. Since December, 1,015 random self-isolation checks have been completed. The requirement to self-isolate is a legal requirement in P.E.I. for all cases and close contacts of cases and anyone who returns to the province. The past week has been challenging for everyone in P.E.I. We have discussed the possibility of a resurgence of COVID-19 in Canada related to a non-variant and new variants of concern. Discussing it as a possibility is much different than experiencing a sharp spike in cases in our own province. The current outbreak is a reminder of how quickly COVID-19 can spread, and that by the time we know there are cases, we actually have an outbreak. We have been in similar situations in the past, and we will get through this together. We'll continue to focus on limiting the extent of the outbreak and containing the spread of COVID-19 in our province. We will be making an announcement tomorrow regarding the alert level red phase, specifically if these measures will be continued or if we will begin to transition back to the circuit breaker measures effective tomorrow at midnight. I urge all Islanders to have the fewest interactions with the fewest number of people for the shortest time at the greatest distance possible for this period of time. The news about the vaccine is a beacon of hope in our fight against COVID-19. As I mentioned earlier, we can see the finish line and we can envision a summer that is different than what we experienced in 2020. So let's continue our efforts together. Let's continue to demonstrate our P.E.I. resilience and adaptability for the next few short months. Let's please be patient and kind. Thank you.
Thank you, Dr. Morrison. Good afternoon, everyone. The past several days have required a tremendous effort from COVID clinic testing staff and physicians, our laboratory staff and physicians, public health, support services, including Island EMS, transportation, and many others throughout the health system and broader public service, not to mention the Chief Public Health Office. Thank you to everyone who has contributed to limiting the spread of the virus, including Islanders who have come forward to be tested and are following the guidance of the Chief Public Health Office. As Dr. Morrison mentioned, since Saturday, we've completed more than 10,000 swabs of individuals. Yesterday alone, over 3,300 swabs were taken at 7 sites across the province, providing more access to testing for P.E.I. than ever before. The laboratory staff have been able to turn these results around within 24 hours, which is fantastic for our patients to receive the results so quickly. As a reminder, this time last year, we did not even have testing capacity for this virus on P.E.I. Thank you to our laboratory team for their leadership and efforts. The achievements of this group over the last year have been exemplary. Today, we continue to provide testing services, and the up-to-date testing site information is available on the province's COVID-19 website. I do want to note that some of the testing clinic hours have changed today due to the weather, in particular in Borden and the Summerside area, and we will continue to monitor the weather and open clinics in this area if weather permits. I'd refer people to the website for the most up-to-date information. It's wonderful news today around vaccinations, and even during this time of outbreaks and clusters of cases in our communities, we've continued to offer vaccines to eligible groups. We've completed our residents and staff in long-term care and community care facilities, and this includes the other groups are healthcare workers, those who are 80 or older, including home care clients, and those people who are waiting to go to long-term care or community care. We've also been offering appointments to our registered rotational workers during this time. Individuals aged 80 and older can continue to book their appointments for upcoming vaccination clinics. The number to call is 1-844-975-3303, or you can book an appointment by using the online booking site, which is located at theprinceedwardisland.com/COVID vaccine. I do want to note there is a clinic happening today for those 80 above in Summerside area, and we have received some calls to cancel those appointments due to travel, and people are able to do that. Then they need to call the 1-844-975-3303 number if they want to reschedule their appointment, and that will be rebooked for you quickly. We are planning for the time and anticipating that time when we can offer vaccine appointments in our community clinics to those next identified groups. I want to give a little update on Health P.E.I. services in relation to the current modified red alert status, and we've specifically made some changes to visiting across the province at our sites. There are no regular or designated visitors at Health P.E.I. acute care or inpatient care areas. Patients may have up to 3 partners in care come to support them. Compassionate visitors are permitted in exceptional circumstances, such as a patient's end of life, also for pediatrics, labor and delivery, or palliative care and critical care. Patients in emergency departments and other walk-in or ambulatory care services, including mental health services, may have a support person accompany them at this time. And there are no changes to long-term care visiting. Residents can continue to have 3 partners in care and up to 6 designated visitors, with a maximum of 2 visitors at one time. I want to thank everyone and all Islanders once again for your patience and understanding, as I know many of you have waited in longer than usual lines to be tested, but you've paid attention to the message and the public health measures that have been put in place. We appreciate your patience with us as we continue to try and offer as quickly and efficiently as we can testing services and results to you. Please stay safe today with the weather and road conditions. Thank you.
Thank you, Marion. Je sais que j'ai pas mis beaucoup en français, mais on a, juste pour mentionner, on a 4 cas qui sont nouveaux aujourd'hui. Ils sont tous dans les 20e âge. Il y en a un qui est relié, on pense, au voyage hors du province, et puis un autre qui est en contact avec des cas ici à Charlottetown, et puis 2 autres qui sont peut-être liés à Summerside et à Charlottetown, et puis ils sont en train de leur parler maintenant. Et puis, les détails de la vraiment phase 2 du vaccin, on va mettre les détails sur l'Internet. Ils ne sont pas là encore, mais on va continuer d'en parler. Mais grand-chose qu'on va, ils vont avoir plus de temps entre la première dose et la deuxième dose. Alors, ça va donner la chance de les adultes ici à l'île du Prince-Édouard d'être offerts un vaccin avant le 1er juillet. Alors c'est, je pense, bonne nouvelle. Yeah. So I'm going to turn over for questions.
Gabrielle Drummond, Radio Canada. Good afternoon to you both. Bonjour, Dr. Morrison. Ma question, ça va être en français. Aujourd'hui, vous avez annoncé 4 cas de COVID-19. Vous avez aussi signalé ces 2 cas qui ont été annoncés la semaine dernière parce qu'il s'agit d'un variant britannique. Vous avez eu ce constat. Je crois qu'on parle maintenant de transmission communautaire. Donc, dans quelle mesure les données que vous avez aujourd'hui entre vous, ça va influencer votre décision de prolonger ou ne pas prolonger les mesures de santé publique et aussi de garder l'île en zone rouge?
Oui, alors on ne voit pas des cas dans la communauté qui ne sont pas liés au cas qu'on vient d'annoncer. Alors, ça a l'air que les cas sont liés ensemble. Et on fait tellement de tests, on a fait plus de 10 000 tests, et puis on ne voit pas les cas qui ne sont pas liées à cette cluster. Alors, on regarde ça, on regarde le nombre de personnes qu'on a testées et on n'a pas d'évidence en anglais, on dit unlinked cases. Alors, quand on a cette information, on n'a pas raison pour penser que c'est beaucoup de transmission communautaire à cause de ça. Alors, je sais que ça peut changer, mais à ce moment, on n'a pas de raison de penser qu'il y en a beaucoup de personnes dans la communauté qui ont la COVID-19. Alors, je pense que à ce moment, ça a l'air qu'on va on va faire une décision demain, mais je n'ai pas l'impression qu'on doit continuer dans la phase rouge à ce moment, ce qu'on sait à ce moment.
Parfait. Et ma deuxième question, c'est par rapport justement au dépistage, parce que vous avez commencé à faire un dépistage massif en fin de semaine et aujourd'hui, quelques cliniques ont été fermées en raison de la météo, d'autres cliniques vont ouvrir en retard. Alors ma question, c'est quel sera l'impact de la fermeture de ces cliniques ou la réduction des heures d'ouverture sur le dépistage massif et aussi sur vos efforts pour contrer la propagation de la COVID-19, surtout de ce variant qui est maintenant ici à l'île?
Oui, et puis il faut mentionner, être clair, que le variant est seulement avec les 2 cas qui sont annoncés. C'est pas relié au cluster du tout. C'est les 2 cas qui sont liés au voyage hors du province et puis s'isolent avec tous ces contacts qui sont proches. Mais on sait que même le nombre de personnes qui ont testé hier était bien plus petit que le week-end. Et on pense que même avec les cliniques qui sont ouvertes, on va avoir la chance de continuer de faire tester beaucoup de gens qui en ont besoin. Et puis, je sais peut-être Marion va en parler aussi, mais je pense pas que le météo aujourd'hui va changer tellement les choses. Je sais que les personnes qui vont être testées vont avoir la chance, même si c'était pas à Three Oaks, ça va être à Slamon Park on peut être testé. I'm just going to repeat one of the questions in English. One of the questions was, what are we looking at in terms of information that we need to make decisions about whether or not the alert level red has to be extended or not. And at this point in time, we are able to connect these cases. They're all linked to each other. They've been connected, or it looks like we'll be able to connect a lot of these cases to each other. We've tested a significant number of people, and despite all those additional tests, we're not getting a whole bunch of unlinked cases. And that's really key to what and important for us to know as we look forward and if we're trying to determine if there's any sort of more widespread community transmission. So with over 10,000 tests, we're not getting, and that includes symptomatic and asymptomatic people, we are not getting those indications of the unlinked cases at this point in time.
Kevin Bizet, Canadian Press.
Yes, good afternoon, Dr. Morrison. I know you said that you'd have more to say in the coming weeks in regards to the AstraZeneca vaccine, but I'm wondering if you're changing your vaccine rollout plans at all now that the National Advisory Committee on Immunization has recommended that AstraZeneca vaccine not be given to people 65 and over.
So when we get confirmation of the exact amount that P.E.I. would be getting of AstraZeneca, we would be targeting AstraZeneca to healthy, younger individuals who are working frontline essential in certain frontline essential services, and that's would be our plan. And offering it to them, and knowing that people will have a choice, but AstraZeneca is showing good evidence around decreasing severe illness and hospitalization. So we'll know more about how many doses exactly, so we'll know exactly which groups, but that is certainly our current thinking.
Okay. And just quickly, wondering, with the two confirmed cases of the variant, are you expecting to see a lot more of the results coming back to indicate the variant?
So it takes up to a week for us to get the results back regarding the variant. And I mean, the two cases that were identified as variant, I think we're very glad that we were able to identify those two cases early enough that they were isolating fairly quickly after return from travel, and their close contacts are in isolation, and I especially knowing after the fact that they involve the variant. I do not know if these other cases are variants or not, but as we've said, we're treating every case as if it could be a variant, but reinforcing the importance of isolation, the importance of our contact tracing, and our ongoing testing.
Thank you.
Yeah, thank you.
Wayne Thibodeau, CBC.
Good morning, Dr. Morrison. I wonder if you can chat with me just a bit more about the modified red alert, the 72-hour lockdown. I believe you said in French, if I got it correctly, that you don't think it will be extended past tomorrow. But just if you could talk to me a bit about that and what factors you'll be looking at for that.
Hi, Wayne. I mean, I think we know how much can happen in a day, so or even in a few hours. So many things can change, but certainly at this point in time, we would be looking to base it on the information we have. And we are able, in terms of the cluster of cases at this point, it appears like there is a connection from our cases to each other, and I think that is certainly reassuring. We've tested a significant number of people, so we look at how many people we're able to test, and there's no indication of these unlinked cases, either in symptomatic or asymptomatic people, indicating more broad spread. So it's given us a chance over the last couple of days to get more information, and we know that there are still 2,000 tests pending, and we'll be waiting those results as they come in over the day. But at this period of time, it certainly looks like they are linked to each other, and if that's the case, then we'll be making a decision, and we'll announce that tomorrow.
Now, I know obviously it's great to have a crystal ball kind of idea, but as you look back now, do you think this was an overreaction? Did we actually need to go into this 72 hours, given the impact it has on the economy, business owners in this province?
Well, Wayne, I think I would much rather sit here and think about why we would have overreacted than be here trying to explain why we didn't react enough, because of the devastating consequences if we don't. So I think the Premier mentioned the other day, we hoped at the time, is this too much? But we would rather it be too much than that we didn't do enough. And it's also for a short period of time. And so we will, we're still getting cases, we're still doing follow-up, but I think we will all be feeling more comfortable if we know it hasn't had, that all the cases are linked. We still do not have a source for any of these cases. We may not find that source, But if we can at least feel that the cases are linked and it hasn't spread any further, we will certainly feel all islanders will be more reassured. But I think the same thing, I know Nova Scotia put in some measures in place, and we had a chance to speak last night, Dr. Strang and I, and we are both, in a similar place, and that's why the circuit breaker measures were put in, and then trying to make sure, especially as we look forward ahead, if we can keep the situation of COVID under control now, it allows us to get the vaccine out to more people and get us in a very different position in this island. We've not had any hospitalizations. We've not had any deaths to date. And I'd like to do our best to make sure that continues until we can protect everyone.
Thank you very much for your time, Dr. Morrison.
You're welcome.
Rachel Collier, Eastern Graphic.
Hi. My question today is about the COVID app. I'm wondering if it has been helpful in contact tracing efforts at this point, or if there's a need for more islanders to download that for it to be effective.
Hi, Rachel. I will let you know that we have had 2 opportunities where the one-time key has been offered to our cases, so that if a case tests positive, they're offered this one-time key that they can download in to their phone, and it will send out an alert to anyone that they've been close to, and that's how the app works. And so we hadn't had any opportunity, or our cases hadn't had the app for many of our cases, but that has happened a couple of times. So what it does, if it sends out an alert to other people to indicate they should go get tested. And so I don't know how many people as a result may have received that notification, but I do know the one-time app or one-time key has been used a couple of times.
Okay. And I guess since you did mention a false negative there earlier, with the type of testing that we're doing now with some folks who are asymptomatic, is there any way of knowing like how many false negatives could be expected? Or I don't know what you'd be able to offer about that.
Actually, so we're using a molecular-based testing for the rapid test called ID Now. And it has excellent negative predictive value. So it has, in a population that doesn't have high prevalence of disease, which would be us and P.E.I, the negative predictive value would be over 99%. So we have a lot of confidence in our negative tests, in our rapid tests. And and that's really almost as good as the PCR, which is sort of the gold standard. So we have really good confidence in our negative test results out of ID Now. So I'm not sure. I don't recall mentioning false negatives, but I have really good confidence. I think if you ever get where the ID Now, if there's not much prevalence in the population, there is more a risk of having false positives, and any positive then is it would have to be confirmed with the PCR tests. But the negative tests should be really, people who test negative with the ID Now rapid tests should be very comfortable. That's negative on that day. It does not mean that if you get symptoms 2 days later, you shouldn't get tested, because all it does is a point in time. It does not mean it will last for days.
Thanks for that. I'm sorry if I misunderstood a comment earlier.
No, that's
Bye.
Laurent Rigaud, Le Voir.
Good afternoon to you both. Bonjour, Dr. Morrison. J'avais une question sur les cas positifs qui ont été identifiés, qui sont liés aux 2 clusters. Les cas positifs, ils ont été trouvés grâce au contact tracing ou grâce aux cliniques de dépistage qui ont été faites toute la fin de semaine?
Les cas, deux cas positifs c'était pas les contacts proches qui ont été identifiés. C'était, ils sont allés pour faire les tests parce qu'ils ont entendu qu'ils ont peut-être eu le contact avec les locations. Sauf qu'il en a eu, il était symptomatique depuis un bout de temps. Alors, vraiment, ils ont dû peut-être être testés avant, mais je suis contente qu'ils sont allés être testés.
D'accord. Et j'avais une question sur ces deux clusters, ces deux grappes, à Charlottetown et à Summerside. Aujourd'hui, est-ce que on est 100% sûr qu'il n'y a aucun lien entre ces deux grappes ou est-ce que vous avez encore un doute?
Peut-être j'ai pas compris. Je pense qu'on a vraiment, on est en train d'en parler avec les cas, mais je pense qu'il y en a un lien entre les deux clusters à Charlottetown et Summerside. On vient de peut-être trouver une relation entre les deux clusters ce matin.
D'accord, merci.
Dave Stewart, The Guardian.
Good afternoon, ladies. I guess first off, that sounds like great news in terms of everyone getting their shot, if I heard correctly. About 100,000 vaccines first shot from April 1st to June. Is the system set up for that? It sounds ambitious. This is just a matter of people will be going over to their pharmacies or booking appointments at their pharmacies. Just wonder if you could expand on that.
Well, maybe I'll start and then Marion can continue. So it really will be a lot based on what there'll be mass clinics set up, and we will also be using our pharmacy partners will be involved, pharmacists as well. And just as a note that we talked about it early on that. We know we gave 80,000 influenza vaccines in this province within just around the same period of time, within 3 months, and that's without any concentrated huge effort and I mean, it was a big effort, but we weren't doing mass clinics or anything at that time. So I believe it can be done. I know it's not going to be easy, but I think we're all motivated to try to do the best we can and get everyone vaccinated. So maybe you want to add to that.
Or, yeah, we've been planning for the mass clinics to offer, thousands of doses at one clinic in a day. And so we're really trying to make sure we're prepared. I think we've seen our experience here with the initial call out for those age 80 and over, where we had some backlog and calls and technical issues, and we've seen that across the country as others have opened up their booking systems. So the eagerness of Islanders to receive the vaccine is also the good news that we have on P.E.I. So we really are doing everything we can to prepare and be as organized as we can so people understand when it is their turn, how they do receive an appointment, where they go. There will be multiple clinic locations across the province, as well as Dr. Morrison mentioned, using our pharmacies throughout communities. So we'll all be working together and needing everyone to work together and listen to the schedule as it comes out, and we'll just keep rolling that forward as we move along. It's wonderful news today.
For shedding light on that. I guess my follow-up question would be, I had heard over the weekend from the Charlottetown, not from the Charlottetown Airport, but in relation to the Charlottetown Airport, that those testing incoming passengers were pulled off to deal with the emergency outbreak. Are passengers still being tested at the airport, and is that testing mandatory?
Yes, I can start. And we did pull those resources that were going to do testing on Friday evening, and since then we've had them deployed obviously at our other two additional or 3 additional pop-up clinics, I think, throughout the weekend to try and meet the surge in testing requirements that were called out to Islanders, and they responded. So that is still on hold at the moment as we're offering the additional testing in other locations. And the other comment would be it is not a mandatory test when people arrive, but it is offered to them.
Yeah.
Dr. Morrison may want to add.
And so I agree with Marion. The only thing I'll add is that it is, if people, when they arrive, it is required that if they want to work isolate or be a rotational worker or an international traveler, those would be categories that testing is required. So they would be tested the next day, so that would continue. So not as convenient as having it done at the airport, but the requirement would still be there if they are doing work isolation or rotational workers, or international travelers would be coming in. And then, of course, everyone else coming off the plane as well has to self-isolate under the order, regardless of the tests.
Thank you so
Okay.
much for clarifying your time.
Okay, thanks. Thank you.
Louise Martin, CBC. Hi there. Good afternoon to you both. Dr. Morrison, just before I get to my question, it's on the vaccines. Can you just repeat in English what I believe you mentioned, a potential link between the Summerside cluster and Charlottetown cluster?
Yes, and I think I did mention that even in the notes. So public health nursing is investigating if these two of the new cases are related to both clusters in Charlottetown and Summerside.
Okay, thanks so much.
Yeah.
Sorry I missed
Yeah.
that in your notes.
There were a lot of things. I said a lot of things, so I had to
Okay.
check.
So on the vaccines, that seems like quite a dramatic shift in guidance with delaying the second dose. And so what I gather is healthcare workers and older Islanders will still get 2 shots. So how are you going to decide who else gets the booster shot, and when do they get the second shot, or do they at all?
So I think I'm glad you clarified. Everyone still requires a second dose. Everyone is going to still require a second dose. But the interval between the first and second dose, Louise, is extended. So right now, the appointments that have been already made for those, for instance, 80 years of age and older, are 28 days apart. And those will continue because we don't want to go in and change those appointments. But going forward, we know there's good evidence that there's good protection that will be able to have after a couple of weeks after the first dose, that will continue, and that we anticipate the second doses will not be required for 3 or 4 months.
What about optimal efficacy? I mean, we've talked about this before, and in the U.S. infectious disease official Anthony Fauci is saying delaying a second dose to inoculate more Americans creates risks. So is there a risk to Islanders who get a second dose later than the recommended time that it will be less effective?
Actually, I mean, we know from vaccines, actually, that in our history of using vaccines, that actually some delay between 2 doses is actually can be beneficial because of how your immune system responds. And so, for instance, some of our vaccines we give now are delayed. There might be a booster dose 6 months later. Sometimes, the booster dose is given 4 years later. And even when you look back at our various young vaccines in childhood. So there's a lot of information about vaccines, and I think this would certainly be consistent with that. Again, we have not, we anticipate this information out of NACI, but we've had a chance to look at some of the emerging evidence that is coming. For instance, most of Quebec has only given first doses to much of its population already, or they've only been doing first doses. They haven't been booking second doses the same way we have. And so I think I actually, this would not be a recommendation if we thought there would be a risk. And I think the risk is not protecting our population when we know there could be more variants either coming or there's variants circulating. So protecting our population as broadly as possible, as quickly as possible, is, I think, a really important thing to do.
Okay, thanks so much for clearing up the second dose part two in the first question.
Yeah.
Julian Lecachère, Radio-Canada.
Bonjour, Dr Morrison. Mes questions vont être assez similaires, mais en français, aux questions posées par ma collègue Louise Martin. Concernant la vaccination, expliquez-moi concrètement, c'est quoi le nouveau plan de la province? Vous dites 100 000 doses et tous les insulaires de plus de 16 ans auront reçu au moins une dose d'ici la fin du mois de juin?
Bonjour. Alors, on a quand même plusieurs mille des insulaires adultes à l'île du Prince-Édouard qui vont recevoir la vaccination avant la fin de mars. Mais après ça, entre le 1er avril et la fin juin, on va recevoir à peu près 100 000 doses de vaccins. Et puis, c'est assez pour faire les vaccinations pour au moins 80% de notre population adulte ici à l'île du Prince-Édouard, avec les adultes qu'on vient de faire déjà et puis les adultes dans les autres groupes jusqu'à la fin de juin.
Docteur Morrison, parlez-moi un petit peu de l'écart entre la première et la deuxième dose. Si j'ai cru comprendre, vous avez dit que maintenant, les rendez-vous pour la deuxième dose sont à peu près 28 jours après. Est-ce que après le mois de juin, quand vous aurez donné une dose à tout le monde, on sera à combien? 2, 3, 4 mois? Parlez-moi un petit peu du délai que vous allez mettre entre la première et la seconde dose.
Alors, ça va être au moins 3 mois, mais j'imagine que ça serait un peu plus proche de 4 mois. Et puis, on attend les détails vraiment de NACI, mais c'est à peu près ces dates-là. Et puis, alors, ça change beaucoup quand on peut vacciner plus de personnes avant la fin de juin avec cette période de temps entre les deux vaccinations que de faire tout le monde entre 28 jours.
Mais il n'y a pas d'inquiétude. Le vaccin va rester aussi efficace entre les deux doses.
C'est plus que 91%.
Parfait, merci.
Great. I think that's it. So thank you very much, Marion, and thank you, everyone. Thank you.